Ask Your Pharmacist Season 5 is proudly brought to you by Dragnet, Letop Pharmaceuticals, Chango, Samuels Pharma Limited, Lotus Opticals, and Mega Life Sciences. This program is in partnership with the Ministry of...
Welcome, friends and family, to your favorite award-winning health show, Ask Your Pharmacist Season 5. My name is Pharm Nellin Ofori, and this show is proudly brought to you by Dragnet, your number one online pharmacy. Letop Pharmaceuticals. Get your Letamin, Folaron Zinc, and Letamox from any pharmacy and stay healthy. Letop Pharmaceuticals. Quality healthcare. Chango. Download the Chango app for all your crowdfunding and group contributions. Get the Chango app on the Google Play Store or the App Store. Samuels Pharma Limited, your trusted and most credible source of ophthalmic preparations and injections. For bulk purchases, call Samuels Pharma on 050-164-6494. Lotus Opticals, your favorite family eye care center. You can visit any of our locations at East Legon, Sakumono, or Tema. You can call on 030-398-1681 or 053-173-6933. Mega Life Sciences. There is indeed a mega product for everyone. Mega Life Sciences, we care. And also, thanks to the Ministry of Health for partnering with us. Connect with us on Facebook at Ask Your Pharmacist, Instagram at _Ask Your Pharmacist, and on YouTube at Dragbase TV. We'll go for a quick commercial break and we'll be right back. Don't go anywhere.
Are you tired of roaming for your medications and can't find them? Do you want to speak to a pharmacist or simply need privacy when buying your medications? Do you want your drugs to be delivered to you at the comfort of your home or office? Then it's time to download the Dragnet app, spelled DRUGNET, from the Play Store or App Store to enjoy total convenience. Use Dragnet, your multiple award-winning online pharmacy, for prompt delivery of all your medications. For further inquiries on Dragnet, call 0593-159-139 or 0501-646-496. And remember, we also accept all private health insurance cards. Dragnet, your number one online pharmacy.
Araba, there are some people at the door. Go and tell them I have traveled to Russia.
Yes, Daddy.
Where's your father?
My father said I should tell you he has traveled to Russia.
Your father has killed me. I sent him money from America to complete my house for me.
Our own student association contributions.
Even the money from the fundraiser for Kweku's surgery.
Oh! He too? Don't be a victim. If you're contributing to a project, alumni dues, or any public campaign, Chango is your best choice. Chango keeps track of all donations and gives you the power to know exactly where the money goes. Chango is approved by Bank of Ghana. Call 0270-066-614 or visit changoapp.com for more information.
Uncle, my father is hiding under the bed.
Oh, Araba.
Chango, for your groupings and crowdfunding.
You're welcome back from the commercial break, and this is season 5 of Ask Your Pharmacist. Today we have a very seasoned guest, and he's the chairman of the Community Practice Pharmacist Association, that is the CPPA. It is the largest pharmaceutical practice group, and he has also provided transformational leadership to the largest pharmaceutical group, that is the CPPA, and he is passionate about professional development, and he has advocated for the training of over 6,000 pharmacists within 4 years. He's also championed the implementation of clinical professional pharmacy services in community pharmacies in Ghana. He is also the presidential candidate in the 2025 PSGH elections. Ladies and gentlemen, Dr. Emmanuel Kweku Ireland. You're welcome, sir.
Thank you.
Okay. Since you are the chairperson of the CPPA, this conversation is very important and I would like to know your inputs. So, as a CPPA national chairman, can you please tell us and our family at home what CPPA is all about and its importance in the Ghana healthcare?
Thank you. Thank you very much. Yes. When we talk about CPPA is the Community Practice Pharmacist Association of Ghana, and it's a practice group of the Pharmaceutical Society of Ghana. Of course, the largest, as you rightly said. And within the Pharmaceutical Society, we have different practice areas. For instance, you have pharmacists who are into community practice. That is, when we talk about community pharmacy, is the pharmacy in your community, in your neighborhood, where you can just walk and have access to pharmaceutical care or health care. Aside the community practice, we also have pharmacists who are into hospital practice, so you find them in the hospitals. We also have pharmacists who are into sales and marketing. So they, for instance, introduce new molecules of medicines that are in the country to us in the hospital, in the community pharmacy, and then elsewhere. So these are some of the practice groups that we have under the Pharmaceutical Society of Ghana. And the community practice happen to be the largest, with over 5,000 community pharmacists that I am leading. Now, when it comes to the role of community pharmacy is strategically placed in our neighborhood. Why? Because you don't need to walk a distance to have access to healthcare or get the medication that you want, probably in the middle of the night. And so the role of the community pharmacist is very critical, yes, when it comes to the healthcare system in Ghana. So community pharmacy, or the pharmacist, is like a gatekeeper within the community.
Okay, so I would also like to know, I'm sure that our family would also like to know, are community pharmacies there for patient care, or they are mainly driven by profit? Because a lot of people, even on social media and other places, you hear that they go to a pharmacy and then the pharmacist is trying to sell them something. In your opinion, do you think the community pharmacy, in collaboration with the community pharmacist, is pushing an agenda for profit rather than the patient care?
No, I don't believe so. Because when it comes to community practice, it's first a practice, okay, and lose. And you have your staff to pay, you have bills to pay, you have to make sure that the ambience of the pharmacy is good, okay, and then you have air conditions running, you have cold chain products that are in the refrigerator and things like that. So at any point in time, these are medicines that are supposed to be kept under very good conditions. So at any point in time, their integrity will be intact, for the safety of the public.
Okay, thank you so much. That was quite insightful. So another very important thing I would like to know is, right now we see a lot of drug abuse and drug misuse. A lot of people will tell you that they walk into their closest community pharmacy and then they purchase these drugs. I personally know there are other pharmacists who are stewards of drugs and then are preventing these drug misuse and abuse. How do you think, as the chairperson of the CPPA, how have you seen pharmacists curbing drug misuse and abuse?
Thank you very much. So, as you rightly said in your intro, I'm very passionate when it comes to professional development. And so we've been enhancing the capacity of pharmacists, in this area where, like I said earlier, we are like gatekeepers in the community. It's not every drug that we give or we churn out into the community, especially when we know that these drugs would have negative effects on people.
And make sure that the drugs that they're taking are safe and approved by the FDA. This has been a very interesting conversation. You are still watching Ask Your Pharmacist. We'll go for a short commercial break and we'll be right back. Don't go anywhere.
What if the world you see could be even sharper? At Lotus Opticals, we don't just check eyes, we decode your vision and protect what matters most, your sight. from routine eye exams to advanced glaucoma and cataract management, from binocular vision correction to retinopathy assessments for diabetics and hypertensives. We see what others miss. Need prescription glasses, contact lenses, stylish, fitted perfect? We have got you.
Do visit Lotus Opticals for all your comprehensive eye care needs. We are also approved by DVLA to conduct all of your driver's license eye tests.
Find us at Tema Community 1, Meridian Melcom, Sakumono Estates, Vulganizer Junction, or East Legon, Nisai Road. Call us on 0303 981 681 or 0531 736 933 or visit thelotusopticals.com.
Lotus Opticals, your favorite family eye care center.
Welcome back.
Community pharmacists, what we do is to ensure that every drug that we stock in the pharmacy are drugs that have been approved, and by regulation that they are supposed to be dispensed from the pharmacy.
So, Doc, you've led the CPPA for 4 years and you have actually done an amazing job. I can see firsthand what you've done with the CPPA. Can you share with us some of your achievements and also the way forward for you?
Thank you very much. Yeah, so you are right to say that I served as the chairman for the practice group for 4 years. Yes, and in my first year, I promised that I was going to restore hope, and thankfully I did. In my second term, I also said that I was going to provide transformational leadership, and truthfully too, I provided that. Now, what am I talking about? When you are restoring hope, it means that people may have lost interest in community practice, especially the young pharmacists. Okay, I don't see why they should come out from school and sit in a pharmacy and nothing is happening. So one of the things that we did to whip up the interest of the young pharmacists in community practice, we introduced what we call clinical professional pharmacy services, which fits into the government's plan of making pharmacists primary healthcare centers or primary healthcare providers. Okay, and then also, in order for the community to benefit from our services, I also champion more pharmacists to be credentialed by the National Health Insurance Authority. Wow. And so that more pharmacists will provide services on health insurance basis, okay, so that the community don't have to walk far to get their medications and that are covered under the National Health Insurance Scheme. And then again, we've also trained our pharmacists to provide pharmacovigilance service. And then I've also championed and also supported the training of pharmacists to provide medication therapy management, where they sit with you, especially clients who are on medications for
chronic ailment.
Solid years
Wow.
of experience. Okay, and I've served on the governing board of the Pharmaceutical Society of Ghana, and whilst there, I served also on the disciplinary committee of the PSGH. Yes, and I've been part of the 10-year strategic plan implementation coordinating committee. Yes, and then again, I have good insight into the pharmaceutical industry. Yes, so. And having led the largest practice group, I have come to a point that I believe that I have what it takes because of my strong focus or background in leadership and governance. And more importantly, the young pharmacists should look out for this program. It's a shame that they've been home, after school, you'll be home for a long time, waiting for clearance to go and have your housemanship done. It's a shame to us as a country. And so what I'll do differently when I come, I'll make sure that there's a safe haven for them, okay, so that seamlessly they will go out there and practice whilst we work on the clearance. Okay, and the Pharmaceutical Society will be responsible for that. And then again, I would also ensure it's what I call the borderless pharmacy, or pharmacy without borders, where, fortunately, the government has an agenda, a policy where they send health professionals out there to other countries where they are needed. I'll make sure I plug into that, policy. And then again, the government's agenda for 24-hour, economy, pharmaceutical industry, for the pharmaceutical industry, I'll make sure I plug into that as well. With this, industry will boost production, okay, and strategically, we'll have very good quality essential medications available and produced in the country. And by that also, we'll be preparing, we'll be pandemic, we'll have that pandemic preparedness. We don't have to wait when pandemic strikes and we'll all be shaking. I'll collaborate with pharmaceutical societies in other countries, in Africa and then elsewhere in the world. And this will be done.
Okay, Doc, any final words for the pharmacists watching and family watching at home?
All right, yes. Let me start with our viewers at home. Viewers, it's been great interacting with you. And we are with you in the community 24/7. Some pharmacists operate around the clock. It's because we want to give you the best service, and then whenever you need the service, you have access to that good quality that you deserve. Okay, so please make sure you get your medication from an approved, facility. Okay, and that is the pharmacy, or an approved and registered over-the-counter medicine sellers. And then again, we can also direct you to the nearest clinic or hospital, by way of referral when the need arises. So please call your pharmacist, and when you enter the pharmacy, please, this is very important, ask of your pharmacist. Okay, we are there for you, for your health care. Now, for my fellow pharmacists, this September, we are heading to our annual general conference in Cape Coast. I invite all of you to come. It's going to be a great time together as pharmacists, and fortunately, it's also going to be a time that we are going to elect our leaders. And I have put myself forward to be your president for the next administration. And the role that I've played as the chairman of the largest practice group of the society. I've been very innovative and provided transformational leadership that has transformed that sector of our economy. And when I become the president, I will do much more for you. Okay. And I believe in you that with your support, we can achieve higher heights. So come. I invite all of you to come. And then also when you vote, vote for pharmacist Dr. Emmanuel Kweku Ireland. Thank you.
Thank you so much, Doc. It has been an amazing time with you. And I hope our viewers at home, pharmacists and family included, have learned something from today's session. And we will see you some other time, and all the best in the elections.
Thank you.
Up next is your dose for healthy living.
Where does pain relief end and opioid addiction begin? Small studies from big pharmaceutical companies that claimed high-powered painkillers were safe and that there was minimal risk of becoming addicted, leading to a wave of over-treating chronic pain. Those include addiction, serious respiratory complications, limited concentration over time, fatigue, and the chance for increased feelings of depression. And over time, patients may start to feel trapped by the pills they were once given to make them feel better. Typically safe short-term opioid uses include surgical patients and trauma patients. Also, opioids can be safely used to treat terminal palliative care patients suffering severe pain and cancer patients with pain that won't respond to other medications. Even then, it's important to know we're living in a whole new world of addiction.
I hope you've enjoyed today's episode of Ask Your Pharmacist. Remember, Ask Your Pharmacist Season 5 is proudly brought to you by Dragnet, your #1 online pharmacy. Lethal Pharmaceuticals. Get your Letamben, Folaron Zinc, and Letamox from any pharmacy and stay healthy. Lethal Pharmaceuticals. Quality healthcare. Chango. Download the Chango app for all your crowdfunding and group contributions. Get the Chango app on the Google Play Store or the App Store. Sambos Pharma Limited, your trusted and most credible source of ophthalmic preparations and injections. For bulk purchases, call Sambos Pharma on 050-164-6494. Lotus Opticals, your favorite family eye care center. You can visit any of our locations at East Legon, Sakumono, or Tema. You can call on 030-398-1681 or 053-173-6933. Mega Life Sciences. There is indeed a mega product for everyone. Mega Life Sciences, we care. And thanks to the Ministry of Health for partnering with us. Don't forget to connect with us on Facebook at Ask Your Pharmacist, Instagram at _Ask Your Pharmacist, and on YouTube at Dragbase TV. My name is Farm Nelly Nofuri, and until next time, it's bye.
Ask Your Pharmacist Season 5 is proudly brought to you by Dragnet, Lethal Pharmaceuticals, Chango, Sambos Pharma Limited, Lotus Opticals, and Mega Life Sciences. This program is in partnership with the Ministry of Health.